So we are Second Lieutenants Alyssa Engel and Alec O'Connell, and we will be doing this little video on therapeutic exercise and Achilles tendinopathy. To start out, just a little background on what a tendinopathy is. So tendinopathy is the kind of umbrella term for any tendon injury, whereas tendinitis is going to be a very acute inflammatory tendon injury. Tendinosis is going to be the more chronic, long-lasting, degenerative tendon injury. And then tenosynovitis is inflammation of the synovial sheath that surrounds the tendon rather than inflammation of the tendon itself. When we look specifically at Achilles tendinopathy, we have two different types and they're based on location. So the first is insertional Achilles tendinopathy, which is seen at the point of insertion of the Achilles into the calcaneus. And this more frequently occurs in younger, active, athletic populations. And then we also have mid-portion Achilles tendinopathy, which is in the body of the Achilles tendon. And this is most frequently seen in less active, older, overweight, and obese patients. This picture just kind of shows you the location of each. So mid-tendon, again, being in that body of the tendon, and insertional at the point where the Achilles tendon inserts into the calcaneus.
For the first article that we reviewed, it was by Rowe et al. From 2012, and it was a systematic review that was level 1 evidence, and it analyzed mid-portional Achilles tendinopathy randomized controlled trials only. It wasn't just Therex, but we used this as like the starting point for our research on treating our patient therapeutically. And some of the common non-operative treatments included both eccentric and concentric exercises, stretching, a lot of different modalities including shockwave therapy, heat, ultrasound, cryotherapy, and then splints, braces, and orthotics as well. It wasn't just Therex. Some of the Therex specific findings that this article found was that first, that eccentric was one of the most recommended and common treatments for Achilles tendinopathy injuries in the research currently. There have been very good results in these randomized controlled trials with eccentric training, and the main finding is that the eccentric exercises stimulate healing and strengthen the tendon. Also on this systematic review that they noted that concentric exercises have also been found to be beneficial, but that has much more mixed results on if it's equal to eccentric or to what degree that the concentric exercises help. One thing that we noted also was that continuous activity below a 5 out of 10 pain level on the visual analog scale was also recommended for most studies to keep patients active and help increasing some of that functionality. And this picture depicts one of the most common eccentric exercises for Achilles tendinopathy, and it is an eccentric calf raise. So you would start on your unaffected side. So on this patient in the picture, their affected side is their right. So they would start on their left leg only in single limb stance, push up to their toes, transfer their weight to their right foot, that's in plantar flexion, and then slowly go into dorsiflexion over the course of about 3 seconds, and then switch back over to the left again. And these are performed 3 sets of 15 a couple times a day. And almost all the research studies that we found included this exercise one shape or another.
The next study that we looked at was also a systematic review, and this one included a meta-analysis. It consisted of 19 RCTs, and the majority of these patients had chronic mid-portion Achilles tendinopathy, although some also were in that acute phase or had insertional. The treatments that this one evaluated are very similar to the last systematic review that we looked at, and so we'll go into the findings of this one. So this study found that eccentric exercise was superior to cryotherapy and a number of other modalities, including heel braces and night splinting, which lacked a whole lot of sufficient evidence to show their efficacy. And then it was also superior to concentric exercises. However, eccentric exercise, ultrasound, and shockwave therapy had very similar outcomes. And when ultrasound and shockwave therapy and massage and stretching were added to the eccentric exercise, they were finding superior outcomes. One of the interesting things that they found was that laser therapy, when added at 12 weeks to an eccentric exercise program, showed a greater reduction in pain on the visual analog scale. And then they also found that there's emerging evidence that supports microcurrent therapy in addition to an eccentric exercise program. One of the main takeaways that the systematic review noted was that a lot of the RCTs looking at Achilles tendinopathy treatment are of relatively low quality, so they determined that more studies need to be conducted to evaluate the proper management of mid-portion Achilles tendinopathy.
Now going to some of the randomized controlled trials, we looked at an article from Baer et al. In 2015 that was level 2 research, and this compared the differences between that eccentric exercise that we talked about earlier and a newer form of research that's on heavy slow resistance training. So that eccentric, like we mentioned earlier, included that single leg only descending portion for about 3 seconds of that calf raise. In most of the studies, and specifically this one, had patients doing that every single day. The second treatment that the other groups got was heavy slow exercise, which included both the concentric and the eccentric portions for similar time points for each. So instead of just the 3 seconds of eccentric that you would get for the eccentric group, you actually got 3 seconds of concentric and a 3-second loading of the eccentric each repetition. Overall, the volumes were similar between the two groups, but the exercises did vary a little bit between the groups. Most notably, heavy slow had a few different exercises that eccentric didn't, that we'll note on the next slide. So on the bottom of this slide on the left, you can see one of the most common exercises that we've been talking about for the eccentric calf raise that the patient's doing. So that is what was prescribed to the eccentric group. Now for the heavy slow group, they had 3 different exercises, and this one is the first exercise that all the patients did, and it's a bilateral calf raise as opposed to the unilateral calf raise that the other group got. And they would go up for 30 seconds and then descend down for 30 seconds for the heavy slow group. And the findings for this study included that both groups produced statistically significant improvements in both pain and activity for the long term and the short term. However, the differences between groups were actually pretty minimal and not significant. One thing of note was that patient satisfaction was actually higher for the heavy slow group that they noted. They didn't go into why that was the case, but patients generally enjoyed doing the multiple different exercises as opposed to really doing a bunch of the eccentric calf raise only exercises.
So one of the things that we've been seeing in these studies so far is that eccentric exercise has been proving to be beneficial for mid-portion Achilles tendinopathy. However, none of them have exclusively looked at insertional. So this RCT is specifically looking at insertional Achilles tendinopathy, and it's comparing eccentric exercise plus a conventional protocol versus a conventional protocol alone. So in this study, they had 36 total patients. 16 were in the experimental group with 20 in the control. And the conventional protocol consisted of gastroc, soleus, and hamstring stretches, ice massage on the Achilles tendon 2 times a day for 5 to 10 minutes, use of bilateral heel lifts, and a resting night splint. The stretches were to be performed 2 times a day, 3 reps for 30 seconds, and the heel lifts were adjustable. So they were to start at 3/8 of an inch and lower them 1/8 of an inch every 2 weeks until no heel lift remained. And then the experimental protocol followed everything from the control with the addition of 2 eccentric exercises. So again, looking at those calf raises for those 2 exercises, in the first one, the knee was bent and they were to lower into dorsiflexion within 5 seconds. And then the second one was the same thing, but the knee was straight. And each of these eccentric exercises was to be performed for 2 sets of 15 twice a day, and patients were instructed to add a weighted backpack if they became too simple for them. So some of the outcome measures were collected at baseline 6 weeks and 12 weeks, and they were looking at pain and then functional outcomes. And they didn't find any difference between the groups in terms of pain and function, but both groups did have statistically significant improvements on pain and function. One of the other aspects that the study noted was that BMI was not associated with outcomes for insertional Achilles tendinopathy.
So next we looked at a clinical commentary, which was level 5 evidence by O'Neill et al. And O'Neill and his colleagues hypothesized and backed up their claims by some of the RCTs that we've talked about into 4 different groups on why eccentric exercises specifically helps Achilles tendinopathy injuries. The first conclusion that they came to was that structural changes occur due to eccentric exercises providing greater amount of loads than concentric or isometric exercises. So the higher loads lead to more hypertrophy, which leads to more strength and increased function. Second, one of the findings that they had was that these eccentric exercises, especially the slower 3-second and 5-second calf raises that we were talking about, increases sarcomerogenesis, which is lengthening of that tendon, which goes right into number 3 as well. That by lengthening the tendon and decreasing stiffness, you can improve the function of the patients. And lastly, for number 4, they included neovascularization as a topic that they indicated affected the pain levels of patients with Achilles tendinopathy. And they noted that through ultrasound imaging in various different modalities, the more of that neovascularization that was present increased the pain. So they noted that eccentric led to decreased in that. However, he noted that in 2, 3, and 4, it's poorly understood why this occurs for eccentric exercise. There's a lot of research on why number 1 happens, but more research can be done on 2, 3, and 4.
The next thing that we looked at was a case study involving a 14-year-old female with chronic Achilles tendinopathy that had been present for over a year, and it was severely limiting her involvement in sport. She had an 8 out of 10 with just half an hour participation in sport. So this individual had previously done a 1-month rest from sport, orthotic arch supports, chiropractic care, and had seen a PT at another clinic with no improvement of symptoms. Upon going to a new PT, they did a protocol consisting of eccentric plantar flexion exercises, proprioceptive training, soft tissue massage, and 8 treatments of iontophoresis within a 6-week time period. With this treatment, they were able to reduce her to a 4 out of 10 pain with exercise. However, they weren't able to get that pain to completely dissipate. So something else they then considered was compression tack and flossing and lacrosse ball massage. So with the compression tack and flossing, they wrapped a TheraBand from mid-foot to mid-calf at 75 to 90% stretch, and then she flexed her knee to go into ankle dorsiflexion and then straightened it back out. And within 2 sessions, so within 1 week of adding these exercises to her current program, she was able to be discharged and had no pain during sport and had improved her lower extremity functional scale from a 66 out of 80 to a 79 out of 80.
So lastly, for our clinical bottom line, we found that eccentric exercises did have a positive effect on Achilles tendinopathy for the various different studies that we analyzed. It was by far the most recommended and studied treatment that we looked at. However, quite a few of the studies noted that more research could be done on things like heavy, slow exercise, and that also heavy, slow, concentric, low continuous activity and stretching are also safe and effective. So generally our conclusions were that eccentrics are a great place to start if you have a patient with Achilles tendinopathy injuries. However, it's not the only mode of Therex that you can use, specifically that heavy slow, which is some of the newer research that's coming out. And overall, it's pretty poorly understood why eccentric is more beneficial than others. So that's why it's important to note that there's more than just one way to create positive outcomes for your patient. And listed here are our references that we noted in the slides.